How can we get a true number of who is infected if testing is hard to obtain both financially and medically for people with no insurance?
Well, that's a great question. So, testing is really ultimately the only way we can determine the actual level of infection. Everything else is extrapolated data from the testing that we have available. Right now, we have 554 positive tests or positive infections in our community. We do know that we're in a period of community spread, so the stay-home order is, in a sense, coming from the public health authorities' guidance that says we have to treat everyone we encounter as if they have the infection. We know the infection is much more widespread in this country than what the current testing shows because simply the testing has not been wide enough in any community. We're working in every part of this country to get it a much wider assessment, get more tests online as quickly as possible, but we do have to assume it's wider than what the data shows.
Next question has to do with the homeless population. What is the plan if somebody that's homeless does test positive to kind of keep them, quarantined?
A couple things. One, if there is a positive, we want to get that person isolated into shelter so that they're not infecting others as quickly as possible. And so we've had for several weeks now a facility under contract where we can do that. Thankfully, we haven't had to use that isolation facility. In addition to that, though, we know the shelter environment, if it's not well managed, generally is kind of a crowded location. So we've been working with Haven for Hope and other shelters to provide for a relief facility so that we can create a little bit more space in the shelters and make sure that we get especially the vulnerable members of our homeless population, a little bit older or immune compromised, into a place where they can be, be better cared for. That's happened literally around the clock for the last week. We've been working on those types of facilities. We've got something in place now. And so I think that the homeless shelters are in much better, stronger position to ensure that they're not vectors for infection.